Hello, everyone. Welcome to the Charting the Course to Better Brain Health webinar, where we'll be discussing the new Healthy Brain Initiative state and local roadmap for public health. We ask you to just be patient for a moment or two while we allow everyone to join. This is the first official webinar about the new roadmap. We are really excited to discuss, to hear your questions, on what you're excited about with the new roadmap. Please note that throughout the webinar, you can submit questions through the Q&A function, and you can also enable closed captioning. And we'll get started. Please accept our welcome and our excitement for the call we're about to initiate around the new roadmap for state and local public health. We're really excited to be with you all today. It's been a little bit less than a month since the roadmap was released, and we already have over 1,200 downloads of the document and 6,000 web page views from the CDC and the Alzheimer's Association roadmap web pages. So really excited about the interest and enthusiasm, and we look forward to the discussion today and hearing your questions. Again, as I mentioned, you can submit questions through the Q&A function throughout the webinar, and we're hoping to have some time for Q&A at the end, and then you can also enable closed captioning. So we are going to go ahead and get started, and we'll start with introductions. Lisa.
Well, good afternoon, everyone. I'm Dr. Lisa McGuire, and I'm from the Centers for Disease Control and Prevention, where I lead the Alzheimer's disease team. And I had the honor and privilege of serving as a co-chair on the development of this fourth roadmap with my colleague, Kristen Clifford. Chair, over to you, Kristen.
Thank you so much, Dr. McGuire. Good afternoon, everyone. As Lisa mentioned, my name is Kristen Clifford. I'm the Chief Program Officer at the Alzheimer's Association. And it was such a pleasure to work with Lisa and the entire leadership committee and all of the external experts who served on various work groups to contribute to this latest version of the roadmap. If you could move to the next slide, we're going to go ahead and get started. So as we think about the discussion today, I know that I personally and many members of the leadership committee, of course, thought about their personal connections to dementia throughout the process of the roadmap. For me, thinking about the impact that dementia had on my childhood and my family when my grandmother was diagnosed with early onset Alzheimer's, certainly thought about the impact of stigma, of conversations and resources in community, and the significant impact that public health could have for families like mine. So as we think about the framing today, I would encourage everyone to think about your personal connection to dementia, the actions that we can take through the roadmap, and how those could positively impact your family and communities that you serve. Next slide, please. So as I mentioned earlier, today is the first introduction to the new roadmap. So we will have time. We'll continue to discuss the roadmap. There'll be time in the fall to dive even deeper. But today we really want to highlight specific items about the document as our first introduction. So first is just the need for public health action, which I'm sure everyone in this call is aware of and understands the urgency and the time that we're in and the exciting changes that we're experiencing. Of course, the public health life course approach will talk about what's new in this roadmap, what's different from previous iterations. We'll also talk about collective outcomes, which are new, different, and exciting right now. We'll also discuss some collateral materials. So what are additional resources and materials that will be coming later this year? And then again, hope to have some time at the end for some discussion and Q&A. And we do have some members of the leadership committee joining us as well. I also would like to acknowledge and thank the CDC for their funding support of this initiative. Next slide, please. So as you can see with this slide, we all know that there is a growing and significant impact of Alzheimer's and other dementia, and that the number of people living with disease will be increasing over the next 20 years. And along with that, the cost, the impact to our healthcare system and our community as a whole. But we're also in a time of significant hopefulness. We are seeing research advancements. We're in a new era of treatments. We're seeing improvements in care and diagnostics. And so we have every reason to also feel a lot of excitement right now. For those who may have participated or seen any of the virtual sessions from the Alzheimer's Association AAIC conference last week, you could really feel that excitement with where we are with research and where we're headed. So when we look at this graph and we see these numbers, I think we all feel that sense of urgency, but we also know that all of you and all of our public health colleagues really have the potential to impact these numbers as we work with urgency to address detection, diagnosis, stigma, and health equity in communities. So at this time, I'd like to turn things over to Lisa to talk about those potential impacts across the life course and areas of public health prevention.
Thank you, Kristen. Next slide, please. This. So I'm going to transition, or sorry, back one, please. I'm going to transition and talk a little bit about the public health action impacts across the life course for brain health. Next slide, please. So there are multiple opportunities for us to think about across the life course. Many times when we think about risk reduction, we focus specifically just on one end of the life spectrum or not. But what I want us to look at is this purple bar. This purple bar is the life course of an individual who will develop dementia. We go from healthy cognitive functioning to some pre-symptomatic brain changes, mild cognitive impairment, mild dementia, moderate dementia, and severe dementia. So since the the third revision of the Healthy Brain Initiative Roadmap, this graphic has been slightly changed, and with the addition and the recognition of some additional phases throughout this disease process. Next slide. And what we're looking at here is we're taking into account the various types of prevention that we see within the public health space or this public health sphere. The first one that we usually talk about is primary prevention. And when it comes to Alzheimer's disease and related dementias, the area that we can focus on is risk reduction. So reducing a person's risk or reducing the likelihood that they may develop Alzheimer's disease or related dementias in their lifetime. What is different about our graphic here is we see the areas of the most impact. So what we're trying to illustrate here is when we're talking about risk reduction in itself is, engaging in specific behaviors that might reduce your risk of later on getting dementia. But at the same time, those are types of behaviors that may also help you remain healthy across the life spectrum as well. Next slide. So the next component that we focus on with our roadmap is the secondary form of prevention or secondary prevention from that public health perspective. And when we talk about secondary prevention, we're usually referring to early detection and diagnosis of dementia. So we can see with our life course perspective here, we see what components or what areas of the life course continuum that is having the most impact on. So we can see when we're starting to have some of those earlier pre-symptomatic changes in our brains, all the way through mild cognitive impairment, as well as the different stages within dementia. Next slide, please. So tertiary prevention. So as soon as those cognitive issues are detected, we really become more concerned about the types of things that can be done to improve the safety and quality of care for a person that's living with dementia, and things that we can do to improve caregiving for them as well. So within this component of public health, we are focusing on that tertiary prevention. So in other words, when a person has been diagnosed, as well as what kind of things that can be done to keep them to help maintain their independence, health, and well-being for as long as possible, but also to provide that support for those people who are providing care for them. Next slide. So this slide is allowing us to see across those various different domains of looking at that public health prevention. So primary, secondary, and tertiary. So what we're trying to look at here is you can see that the roadmap that we're going to talk about today, this roadmap is charted from a life course perspective across the whole continuum. So we're looking not just for older adults, but we're looking entirely across the life course. Next slide. So the life course approach and public health opportunities really are key across those levels of prevention. and really were the foundation for the original roadmap that we created in 2005. And really, that's that same structure that we have continued to build and evolve our roadmaps around. So today we're really excited to share with you the fourth edition of our Healthy Brain Initiative roadmap for state and local public health departments, as well as their partners. This document was backed, reviewed, developed with more than 100 leading subject matter experts across a variety of domains who really gave the best knowledge and really gave us their insights of where the science is, where we see the science going, and really making sure that we are drawing on some of that most recent research that Kristen talked about that was launched at AAIC. So we had lots of excerpts, we had evidence-based research, and really there's a strong commitment in this roadmap as well to decreasing many of those risk factors that could contribute to cognitive decline. The big thing about our development of our roadmap is we were thinking about impact. So we want to really focus on those outcomes. What will make a difference in people's lives within your community? And so you'll see some differences in the way the roadmap is developed this year. And Kristen is going to tell us about some of the new aspects.
Thanks, Lisa. So, as mentioned, this is the fourth iteration of the Healthy Brain Initiative roadmap for state and local public health. So, we're excited to highlight what is new and different. And the first thing we wanted to share and focus on is the increased emphasis on community partnership. As you will see in the roadmap, we did reorder and rename the domains. And with our emphasis on partnership, that first action is now P1, which is focused on developing coalitions. There are also other actions that you'll see that really highlight the emphasis on partnerships. One of the other thing that's really important to highlight is health equity. And so I want to talk a bit about health equity. There are actions that take a health equity approach in calling for health departments to engage the community in the development of messaging and programs. But really, from the onset of the development, health equity was a huge area of focus for the leadership committee and for the work groups in how we wanted to develop the roadmap. And we had a lot of robust discussion and effort that went into being very intentional with this work. So health equity, you will see, is much more explicitly called out, both as a chapter in the front of the book, as well as throughout many of the actions throughout the roadmap. Equity, as I mentioned, was really central to that development process. We did have a specific work group on health equity, but we ensured that all of the work groups focus on equity as a central point with discussions and development. So in addition to the chapter on equity and social determinants related to brain health, there is an expanded glossary. As I mentioned, there are the embedded actions throughout that focus on equity. And then the next thing that I'm going to talk about around the evaluation tool will also highlight ways to measure health equity impact, which is really exciting because it was really important. We had a lot of discussion around ensuring that we could really look at what outcomes were and ensure that the actions that we're taking have the intended impact. So if you could move to the next slide. So some other things that are new. One thing that's new is this wheel, which I'll talk about in a moment. But continuing on the conversation around outcomes, it is very exciting that this is the first roadmap to have outcomes. So there will be an evaluation tool for the roadmap that will be released later this fall that will work through specific ways that health departments can measure against these outcomes. We will also, at the Alzheimer's Association, be evaluating the impact of the roadmap. So in addition to these outcomes, the actions within that M domain do focus on data collection as well as data translation and sharing findings and data with partners. So you'll see action M3 is about evaluating the work that you're doing as a part of the roadmap. As I mentioned, you'll see this beautiful wheel is also new. This has been adapted from the previous roadmap framework to include the updated order of the domains, the updated domain names, and again, to show health equity at the center to really emphasize how crucial and vital and integrated we wanted health equity to be throughout the roadmap. So in terms of those domains, you'll see them on here. The names in this version of the roadmap that we landed on were strengthen partnerships and policies, measure, evaluate, and utilize data, build a diverse and skilled workforce, and engage and educate the public. The outer ring shows the areas of practice that are the focus of the actions in the roadmap and align with the work groups that developed the actions. So you can see there are community clinical linkages, caregiving, early detection and diagnosis, and risk reduction. So to go through the domains in more detail, we'll turn things back to Lisa.
Great. Thank you, Kristen. So the first of the domains that I'm going to talk about today is this strengthen policy and partnership. So when we go through each of the domains today, we're not going to go through a detailed review of each of the individual actions. So instead, I'm going to briefly highlight the outcomes that are provided in each of the domains. And these outcomes are going to be how we are measuring the national implementation of the roadmap. And as Kristen pointed out, that evaluation tool will be ready this fall. So our roadmap is very nicely color coded with the icons that represent also each of those specific domains. So when we see within the policy and partnership domain, these actions in general are designed to increase community partnerships, increase integration with other chronic disease efforts, and increase policy action and implementation. Next slide. We will move over to measure, evaluate, and utilize data. And really, what we're trying to think about here is we really are wanting people to use data and use data for decision making and use that data to drive their action. So you can see the outcomes listed here are to increase data availability, the quality of the data, and also the key, the utilization of it. The second one is really helping us think through increasing data informed decisions to make and choose the actions that we are doing. Next slide, please. This is the third domain, and this has built a diverse and skilled workforce. And really, what types of outcomes that we're looking for within this domain is we're really wanting to reduce stigma and bias about cognitive decline in general. And then also, we want and hope that our actions will allow us to increase the knowledge and skills of current and also future workforce professionals. Next slide, please. The final domain is to to engage and educate the public actions. These actions are designed to increase public knowledge about brain health, risk factors for dementia, and benefits of early detection and diagnosis. Also, other outcomes that we're looking for with the actions are to increase public knowledge and use of services for people living with dementia and their caregivers. And now I'll transition back to Kristen.
Thank you. So it's my pleasure to now introduce our panel members today. These are a few of the members of our leadership committee. So want to thank all of them, not only for joining us today, but for all of the work that went into the roadmap. So I'm pleased to introduce Dr. Nadine Gracia, President and CEO of Trust for America's Health, Dr. Barack Gaster, Director of Cognition and Primary Care and Professor of Medicine at the University of Washington, and Marty Mackey, Chief Program Strategy Officer for the National Association of Chronic Disease Directors. So if everyone who's participating has any comments or questions, now would be a great time to submit them via the Q&A feature. We are going to ask a few questions of our panel, but then we will have time. So if you have any comments or questions, things you're excited about, or things you want to inquire about, please do think about that and start to enter that into the Q&A. I'd like to start with Marty. Marty, your organization, the National Association of Chronic Disease Directors, serves these directors to support them in their role. How do you see this new version of the roadmap impacting their ability to further integrate brain health into their chronic disease portfolio? And how do you think this document can help them and their staff?
Well, thanks for the question, Kristen. It's great to be here and to celebrate this major milestone. So thanks for having me. All along the process of being on the leadership committee and working with my colleagues to talk about this very issue about sort of integrating with other types of initiatives, it was really an opportunity for us to discover what that could look like. And The Healthy Brain Initiative Roadmap, the new one, really outlines that well. It's such a valuable resource for all chronic disease practitioners, whatever level they're at, to really leverage their expertise and the work that they're doing to include brain health in their awareness campaigns, for example, the way they educate policymakers, the utilization and collaboration of cross-sector partnerships. Those are so important. And so these being the forefront of this guide and this roadmap is really going to be valuable for them to know exactly where they can make a difference. I think about all the conversations we had about how we integrate this effort within all of the existing chronic disease initiatives that are out there, and there are many. And I don't think we came across one where we couldn't make the connection and where we couldn't elevate brain health in that process. All of the actions have some chronic disease embedding or integration as a directive. And so I'm really excited to see where this goes and for this roadmap to be that guiding force for those practitioners. The other thing I guess that's really exciting is the fact that we're measuring impact, and chronic disease practitioners for forevermore have always been asked about the data and about making the case. And now that we have all of the action steps within this roadmap to be able to do that as it relates to chronic disease, is just going to be more compelling for policy and change. So thanks for having me, and I'm excited to have this conversation.
Thank you very much, Marty. So I'm going to turn to Nadine. So Nadine, you're from TIFA, which is Trust for America's Health, and your organization is a leader in the age-friendly public health movement, which is really, really becoming bigger and bigger and bigger. So how do you see the roadmap fitting into that strategy?
Thank you, Lisa, for that question. I echo Marty's appreciation to be a part of this discussion today, and just the excitement about this fourth roadmap being released and being such an important tool. I agree that throughout this process of serving on the leadership committee, really this commitment to providing a roadmap that is actionable and that centers health equity really was at the forefront of the conversations that the leadership committee held over the course of the months of the development. And I'll actually take a step back even really to speak about public health broadly, of how this roadmap also has great alignment when we think about public health foundational capabilities. The emphasis on partnerships, as we know, being a critical foundational capability, the focus on policy as well as communications when we talk about educating the public, and around assessment and data. So there's clearly that alignment, and that's really a benefit when we think about the role of public health and being able to use these types of frameworks to then really design the types of interventions and policies and programs and direct resources in particular to communities and people that are most in need. With regards to the Age-Friendly Public Health Systems initiative that TIFA leads, with the support and generous funding of the John A. Hartford Foundation, I would say the motivations are similar, of recognizing that public health just has such a key and vital role to be able to play when we think about healthy aging, and here in particular, promoting brain health. So I know that that public health departments really are going to be seen as an opportunity to bring together these frameworks to really develop the types of strategies and approaches towards assuring that older adults and individuals living with dementia have the ability to live their fullest life. And I'll give as two examples really of some of our partners in this work. One is with the state of Florida, that the county health departments, for example, are collecting and analyzing data on older adults living with dementia so that they can identify areas of need in their community health improvement plans. Well, this roadmap is going to be very helpful when we think about specifically brain health and action steps that can be taken as they're developing and utilizing this data. And so there's alignment there with regards to how do we have data-informed policies and programs to really promote brain health. And then as a second example is our partnership with the Mississippi State Department of Health. And this is specifically around the educating the public and communicating information. There's alignment there about educating the media, thought leaders, other community influencers about healthy aging and dementia-friendly policies. And also when both you and Kristen spoke about the issue of stigma and bias and certainly the disparities that we see. It's how, for example, ageist language actually perpetuates that stigma. So we have some clear examples of alignment with age-friendly public health systems and the 6Cs framework of becoming an age-friendly public health system with this fourth roadmap for the Healthy Brain Initiative.
Thank you very much, Nadine. I think your comments also illustrate the amount of work that we all need to be doing and have to be doing. And it will take all of us. And hopefully this roadmap will help guide us in those efforts. So Barack, I'm going to turn to you. So in the roadmap, you're quoted as saying, early detection leads to better care, and primary care is the entryway to make that happen. So how do you see primary care, the primary care community and public health community working together? And is the framework of the roadmap one way to help do that?
Yeah, thanks so much. Absolutely. I think, one of the things that was like so meaningful to me being part of the development of this latest iteration is just like the increasing awareness of just like how essential primary care is as the gateway to brain health across the lifespan, that it really is primary care who, patients trust and who patients sort of want to go see, so they don't want to necessarily go see a specialist. They want to see their primary care doctor to ask the questions that they have and to really kind of get connected to the things that we can do to really make a difference, before dementia, before cognitive impairment, and as cognitive impairment is beginning. And just that it's because primary care is connected to the other aspects of people's health that as we start making these connections to sort of hearing loss and to sleep apnea and all of the other comorbidities that we're increasingly aware, hypertension, are just so important. It's really primary care that's there at the center that is really sort of where these changes can happen, and that it really is. The message that I keep wanting to spread is that primary care providers really are increasingly eager and willing to take this on and to learn about it and to do a better job with it. They just need more training, and that's the Alzheimer's Association has done an amazing job of surveying primary care providers and finding that, contrary to what some people sort of think of, like, oh, we'll never get primary care interested in this. Primary care is aware that they sort of need and want this. They just need the training. And, that's really what my team at the Cognition and Primary Care program is really trying to sort of connect to is tailoring that education sort of by primary care and for primary care, and really hoping to make it available to departments of health and primary care people across the country. And, get down specifically to, what do I think sort of departments of health can do to connect to primary care. I think one of the most important things is the idea of a one-stop portal that primary care can point to that puts together all of the key support resources that are available, at the state level. But I think it really gets down to the county level so often. And so it really is state health departments really putting that focus on what is available at each county in our state and how can we really make that easily visible to primary care providers who are really sort of struggling and feeling like they need and want to know how to point their patients to those resources. And then, just like models of quality improvement. I think that departments of health really can play a role in partnering with primary care health systems to sort of make the connection to improving quality of care, which for primary care, which really is about training primary care providers on how to detect cognitive impairment early, how to make a difference with brain health, way before cognitive impairment even begins. And really it's pairing the brain health message together with the heart health message, which is like the center bread and butter of what primary care does. And I think departments of health, really public health, can really play such a role in bringing primary care in to understand that we don't have to invent a whole new sort of system and wheel. You're already sort of so engaged and aware of heart health. And so let's just like add brain health to that message and really make a big difference. And it's really it's training and at this in the state of Washington, just to call out the amazing work that has been done here, like even, way before I was involved in this area. So the Washington State has a dementia action collaborative that really, I think, should be a model across the country of bringing stakeholders across the state together and really focusing on how can we work together to sort of get the message out in the public health arena that can really include quality improvement initiatives that include training for primary care. That I really think that this latest iteration of the Healthy Brain Initiative really makes that connection so much more sort of clear and concise than I've seen in prior iterations. And so, just super proud of how it came out and so grateful to everybody who was involved in helping it to happen.
Thank you so much, Barack. When you look towards the end of the roadmap, it concludes with a kind of what if message as we work to build capacity in this changing landscape. And we talked a lot about the what ifs. The leadership committee had some robust discussions and our work groups as well around what is this landscape going to look like over the next few years? And what are the things that we need to prepare for and think about? And those changes are evolving much more rapidly than in the past. So, I think even to what Barack was just mentioning, when we think about the primary care landscape and the involvement of those clinicians in this era of treatment, the conversations we're able to have in community around stigma, around detection and diagnosis, around those who may be eligible for treatment now or in the future, and then those who will not be eligible for treatment. All of those things, the evolution of the research that we have in health services and risk reduction, there's just so much happening right now in our space. So I have a question for all of the panelists, but Brock, I'll start with you. So thinking about those what ifs, what progress do you think or hope this roadmap will drive? And when you think about having this conversation, all of us regrouping in 2027 and looking at the outcomes and the evaluation tool that we were able to address with this roadmap, where are you hoping that we are as a public health community? And what are you hoping that progress looks like?
Yeah, I mean, this is, I was, telling Shelby just before we started here that the timing of this is all sort of, either some amazing coincidence or some sort of very, very carefully coordinated, just, I mean, I got back from the AIC meeting actually just yesterday, and the feeling in the air of how the signs that there are that like never before, early detection and treatment is more important than ever. And it's, yes, the sort of, the news that came out last week is big, but I think what is big about it is really that, that this is like a first tiny step to where we really sort of like can now suddenly imagine being, in 3 or 5 years where, that primary, and this is, this is what primary care sort of cares about so much. I mean, right now it is possible to make the case to primary care that like, boy, oh boy, you can make a difference with this disease and early detection. But, FDA approved medications for early stage cognitive impairment really are kind of a game changer. And I really do think that the roadmap should really help to provide a path to raised public awareness and of the importance of early detection, and that public health really can sort of, magnify the sense of what does that mean for people, that but I really would want to emphasize how much more this still is so much more than prescribing a medication as much as it is, really like all of the risk factors that we can make, along the stages before cognitive impairment occurs, and also just in its early stages that, those are still sort of like front and center, the big impact bread and butter that we can be making. But you just sort of add that little kind of like, well, what if, and all of a sudden it doesn't really work to sort of wait a year or two or three. But really, if we're going to sort of like delay the progression of this disease, we really do need to be doing it at its very earliest stages.
Thank you. And Nadine, same question for you. Thinking about those what ifs and the progress that the roadmap can drive, where are you hoping to see us in 2027?
I think, one of the great things that just given its name as a roadmap is how you are able to then operationalize really these goals. And that's, excuse me, such the utility of the roadmap for public health to be able to have these type of concrete action steps that can be tailored, right? We know tailoring them to the communities that are being served. And I think the opportunities and the visions of where we can be in the future, one, both Kristen, you and Lisa started out with this is not public health alone. And so one thing to see progress is really the intentionality around multi-sector engagement. We see great examples of that, how we can see that continue to flourish, that it really is going to require all sectors engaging in promoting brain health and broadly promoting healthy aging, and recognizing that these objectives around partnerships and policy and data and educating the public, all of those entail this need for multi-sector engagement. And there are opportunities. One of the opportunities, for example, is the work that's happening in many states with regards to developing and adapting multi-sector plans for aging. Well, by having that type of movement within the states and then giving a resource and tool like the roadmap, it gives states those kind of concrete action steps that can be taken and that can be incorporated into those multi-sector plans for aging. I know a second area I would say is really the opportunity and leveraging the moment of the age-friendly ecosystem movement, recognizing again that there are multiple sectors: public health, health systems, universities, home and community-based services, as well as cities, communities, and counties that are all engaged in this work, the workplace and employers. And again, utilizing the roadmap to be able to inform each of these domains with regards to the ecosystem and how we think about this in these various sectors, to then also evaluate progress in each of those sectors, I think is going to be really a helpful tool. And then thirdly, I would say is also for some longer term change and systems level change, is with regards to these community health improvement plans, the community health assessments, that really those should incorporate these healthy aging indicators, really have some focus and emphasis in brain health. We at Trust for America's Health just partnered with the National Association of County and City Health Officials to release a document supporting this work. And I think that the roadmap can really be a complementary tool to understanding the indicators, and both indicators that are specific to brain health and more broadly to healthy aging. Doing that, then you can also have some accountability of where you hope to accomplish, what you hope to accomplish in year 1, in year 2, and in 5 years and beyond. So really, to Barack's point, it's the timing of this is really so relevant and needed, especially when we think about disproportionate impacts that we see on certain communities, is assuring that there is an actual roadmap that's centered and prioritized equity, and that's really having a comprehensive approach across all of these domains that then says everyone has a role to play. And public health, convening multi-sector partners, that's in public health DNA. This is not new to public health. And so that's a great role that the public health system can play.
That's all fantastic. And you're absolutely right. That is in the DNA. And so leveraging the excitement and the timing that we're in right now, there's just so many opportunities for us to think about those partners. So Marty, I know that Nadine and Barack shared so much, but also want to pose that question to you, thinking about what ifs and what we'll look like in 4 years.
Yeah, well, I fully echo my colleagues' statements. I mean, I'm fully on board with that. I guess what I would add, and well, we did have quite an extensive amount of time dedicated to the what ifs. So I really appreciated that in the process, because we have to think about that. Things are evolving and changing and opportunities are coming along. The roadmap is designed for that. One of the things that I would add to what my colleagues said is really the role of, it's particularly chronic disease public health practitioners in those community clinical linkage partnerships. And some of the what ifs in the treatment space is access, and how we can really cast a spotlight on the skills, the tools, the approaches that public health has been successful with in the past around access issues for treatment and prevention, for that matter. And all the partners that are part of that can be the same partners for this issue, but really focusing on that in the what ifs space, knowing how this is all evolving. There's so much to be learned with the work that we've done in chronic disease around diabetes prevention and control, and heart disease prevention and control, and stroke management, and cancer survivorship, and all of those things that public health practitioners play a role in learning from those for brain health as well. But I do believe that the community clinical partnerships practice area is a real opportunity from a treatment perspective, in addition to what, Barack and Nadine have indicated as well. So really casting a spotlight on those efforts and embedding these messages within those same efforts. That's what I would add.
That's great. Thank you so much, Marty. I think we're going to take a moment or two just to share a few additional resources, and then we should have a couple more minutes to ask our panelists a few other questions. If we don't get to all the questions today, we'll let you know how we'll be following up on that. But I'll turn things back to Lisa for a moment.
And actually, before we do that, I can't let that sort of access word go, without just adding in terms of the what if, that, that we've all seen like the enormous access problems to get in to see specialists already. And the what if impact on access to specialists is really a little bit mind boggling. I think every memory clinic in the country is kind of quaking to try to figure out, how to sort of think about what the next few years are going to look like. And so I would just really sort of make the point for public health that primary care is in so many ways the solution to that access problem, that we need to really train primary care better to do the initial evaluation and make sort of smarter referrals to specialists to really address that access problem.
Well, I want to thank our panelists for the challenging questions on those what ifs, and they will be sticking around to get some of the questions from our attendees. So then, John, there we go. So in developing the roadmap, you've seen some of the new improvements that we've done. One of the things that we have done in some previous versions of our roadmap is we have included case studies or studies from the field. But this time, we really were looking for a variety of different case studies across the United States, those who have achieved some who achieved small but meaningful accomplishments, all the way up to those who have done major work and leveraged funding from multiple organizations and support. So the neat thing I think about the roadmap case studies is those icons that I pointed out to you when I was going through the domains. Each of the case studies that's listed has the corresponding icons of some of the different types of actions and some of the different impact that you hopefully will see that occurred within those jurisdictions. And I want to thank all who submitted case studies for this. And we will move on to the next slide, please. So I want to share with you a couple more of the resources that are currently available. So we have first the executive summary that you see here. And the cool thing about the executive summary is on the back side, it gives all of the roadmap actions listed by domain in one handy, easy access location. The second is the What's New document. And so Kristen did a great job of highlighting some of those new features for us. But this document points out some of those specific features and also does a great job of explaining the domains on the back side of that as well. So these are the two materials that are currently available in addition to the roadmap. Kristen highlighted that there's more to come this fall, and I'll turn it over to Kristen to share more about the fall.
Great. Thank you so much. So our most common question we've been receiving so far is, will there be hard copies? And the answer is yes, absolutely. We hope that you will look for us and find our booths at the Gerontological Society of America and American Public Health Association conferences this fall. But you will also hear from your local Alzheimer's Association chapters this fall when they have hard copies to share. We're also very excited to hear the announcement from the CDC on the next round of Gold awardees. And as mentioned, we'll have additional resources released this fall, an implementation guide, topic-specific issue maps, and an evaluation tool. So please sign up for our e-news to stay up to date on when those resources will be available. And now it's my pleasure to introduce Shelby Roberts, who will help us answer other questions that have come in for our panel. Shelby is the director of the Healthy Brain Initiative for the Alzheimer's Association.
Thank you all so much for a great panel. And we've had some really interesting questions coming in. So I'm going to start with one that I think maybe Lisa, you might want to start this one off. And the question is, what is your plan to engage underserved communities, immigrants, and people whose primary language may not be English? So Lisa, I didn't know if you wanted to talk through a little bit of what we were thinking in those actions in the E domain. And then also one of those great case studies from California talks a little bit about this as well.
All right. Well, I think Shelby just gave my answer. So we need to look at the California case study. So we have a variety of different things going on that I think really we're hoping to get to the issues of some of the underserved populations, as well as some of the language issues. So with the development of this roadmap, we were very attentive, as you saw, with equity, which is why we have that brain and we have equity in the center of our wheel of the quadrant with the different domains. But we are working with some of our partners to get information out within jurisdictions, as well as our Bold Healthy Brain Initiative or our Bold awardees that we're working with some of the specific populations in their jurisdictions, as well as we fund Bold Healthy Brain Initiative, Healthy Brain Initiative awardees. We fund a group that looks at American Indian Alaska Natives. We fund another group that looks at African American and Hispanic adults. And we also fund another group that looks at adults with intellectual and developmental disabilities.
Anybody else want to weigh in on that question?
I mean, as well as many of our materials on CDC's website, so cdc.gov/aging, are translated, and they're translated into Spanish, but we do need to work on translating them into more languages.
Shelby, I'll jump in just to say, in the discussions that we had within the leadership committee, and you'll see that reflected in the actions, the importance really of culturally responsive and appropriate materials, messaging, communications to really reach diverse audiences and ensuring that the materials are accessible, equitably accessible. It's also reflected with regards to the workforce itself and recognizing the importance of continuing to diversify the workforce. I see a lot of questions around the workforce and training and education. It's also ensuring that we have a diverse and inclusive workforce too, that is representative of the community that it's serving. And really understanding too that with all of these actions, that focus on equity is interwoven. And so it's not a separate action that health departments or others in public health can be taking, but really how you take those action steps and ensure that you're thinking about who might not be at the table, who might be disproportionately impacted by these issues, who may not have the resources, and then really understanding what are the types of partnerships that you need to engage in. And so that's where the value too of community-based partnerships, partnering with others who have trust and working with communities that often are marginalized and underserved. That's really core and key to being able to assure that there is equitable access and resources and outreach and education.
Good, Brooke.
Yeah, and this is just a great moment to mention federally qualified health centers. That really, as we think about public health engaging with health systems in their county and in their state, um, a lot of the health systems are distracted and can be hard to reach. And whereas the federally qualified health centers are still, in a wonderful way, still so mission driven and still really focus on improving the quality of care. And so I think the idea of prioritizing partnership with federally qualified health centers is a really, really important way to show the prioritization of health equity.
Yeah, Brock, I think that leads into the next round of questions. We had a lot of questions come in around primary care. So one person says, as a caregiver and advocate, I'm thankful that the infographic includes health equity. How will medical professionals receive this valuable information in the HBI roadmap? So I wanted to see if you could maybe talk a little bit about how you work with the state of Washington. And then also I saw you had flagged some of the other questions that had come in around primary care and recognizing that all primary care physicians may not be as aware of the roadmap as you are.
Yeah. I mean, I think definitely for me throughout the process of the development of this latest iteration, I was always aware of the audience for this roadmap being public health officials. And so, so I would I would highlight that this is not necessarily, what health professionals sort of need. This is not the framing that health professionals need. And so the advice that I can give to public health is to use the roadmap to then sort of think about what do health professionals sort of need and care about. And I think what they need and care about is, just like the real kind of paradigm shift of brain health being something that is now evidence based. That it's not just it's not just like a catchy sort of trendy term, but that it's something that really is important to start to sort of implement in the primary care space, and that the tools that are in the 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 Healthy Brain Initiative are really tools for public health to use to connect to health professionals around here is the healthy brain sort of message that is so easily combined with the heart health message and is so easily combined with the 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 need that so many primary care health systems are increasingly aware of like, wow, we really need to do a better job with this cognitive thing that we have been sort of struggling and ignoring because we don't really feel like we know how to address it.
Yeah, and I'll just add to that, Shelby. I think, with Lisa's presentation around the primary, secondary, and tertiary components of the continuum, that's where the opportunities come of where public health engages with a variety of partnerships primary care and other clinical sector partners being some of those partners, and finding where that is and where that needs to be, and pointing out that primary care does risk reduction too. And so to Brock's point, bringing in those brain health messages along with all the other the materials and asks of from public health of the clinical sector. So I agree, we had to, throughout the process, remember who the audience is for this particular roadmap and how it's going to impact multiple sectors, from employers and business all the way down to the clinical sector. So, I think in answer to the question, there's just multiple opportunities to get the messages in front of healthcare providers, particularly primary care.
Well, thank you so much to our panelists. Unfortunately, there were a lot of great questions we didn't get to, so we will develop an FAQ document that addresses all of those questions and make sure that we send that out to everyone. We really appreciate your engagement so much. There is a link in the chat to feedback, just to if you want to take 2 minutes of your time and let us know what you thought of today's presentation and what else might be useful and helpful. We'd love to hear from you. Lisa, I'll turn it to you in a moment if there's anything you'd like to add. And then we do have a video that we'd like to share as we end today's call. Lisa?
Thank you so much, Kristen. So I want to thank our panelists. I want to thank our over 100 different steering committee members, work group members, reviewers, that we're all involved in this 18-month process to develop this document. We put a lot of our heart, our passion into it, and it really shows in the quality of the product that we are able to talk about today. So thank you all, and thank you, Kristen, and the Alzheimer's Association for being our host today.
Throughout history, public health has had an overwhelmingly positive effect on population wellness. As a result, people are living longer in communities all over the country. But as the size of the U.S. population aged 65 and older continues to grow, so too will the number and proportion of Americans with cognitive decline and dementia. Just as with other chronic conditions, the best way to reduce risk for the greatest number of people is to act now. The updated Healthy Brain Initiative Roadmap is a framework designed to help public health professionals lead with urgency and act for impact in their communities. With practical guidance and strategies that align with existing public health efforts to mobilize community partnerships, prioritize and pursue health equity, and focus on measuring results. Through public health, we can improve brain health across the life course, enhance policies and systems to reduce the risk of cognitive decline, expand access to early detection and diagnosis, improve safety and quality of care for people living with dementia, and attend to caregivers' health and well-being. Together, we can accelerate progress for brain health in all communities and reduce the risk and impact of dementia throughout society.
Our thanks to all of you for your participation and engagement today, to our panelists, and to Lisa McGuire and the entire team from the CDC. Have a wonderful day, everyone, and we look forward to connecting on the roadmap again soon.